Hello, I'm Elvira. I'm the CEO of Comfort Talk, and I would like to share with you a talk that was chosen as a featured abstract for the 2020 annual meeting of the Society of Interventional Radiology. There are over 120,000 medical health apps on the market, but very few are tested clinically and even fewer against the control. This makes it very difficult to assess efficacy. Efficacy is particularly important in the age of COVID because we want to minimize physical patient contact while continuing to reduce patient pain and anxiety. Fortunately, NIH support enabled us to build an app and a control app to test the concept of reducing patient pain and anxiety in your waiting room. I hope this talk will help you choose efficacious apps, whatever the indication. This grant mechanism actually requires us to be a business, which I founded as Comfort Talk, and where 3 authors are employees, as our disclosure. I receive royalties for books and own a patent for the app, which is available for free in the iOS app and the Google stores. The Tufts investigators who conducted the study, collected and analyzed the data, have no conflict of interest. The app derived from our previous extensive work in assisting clinical teams. In 3 prospective randomized trials with over 700 patients in IR, we showed that reading a self-hypnotic relaxation script while patients were on the procedure table made these procedures more comfortable, safer, and faster by reducing pain, anxiety, drug use, and complications. In subsequent trials with over 130,000 patient visits, we showed that training staff using calmative language, including wording from the prior scripts, improved scan completions, throughput, patient show-up rates, and satisfaction. Then we thought about applying these language snippets for reducing pain and anxiety to a patient app. We focused on the waiting room because anxiety there is high. High anxiety predicts poorer procedural performance. Thus, we kept the app simple, just having 4 topics, varying voices and lengths, 4 extras, resulting in listening options of 4 to 11 minutes. We designed a white noise control, here seen on the right side, to have the same look and feel as the self-hypnotic relaxation app, seen here on the left side. We tested the app in the waiting room of Tufts University Dental School in their Craniofacial Pain Center. We expected anxiety there to be high. It's close to drills in dentistry, and pain similar with procedures that we experience in interventional radiology. We randomized patients to receive the self-hypnotic relaxation app or white noise app in either iOS or Android versions and measured pain and anxiety on 0 to 10 scales, with 0 none at all and 10 worst possible. Comparing the combined iOS and Android groups, there was a significant reduction in pain with the self-hypnotic relaxation app, but not the white noise app, and that group difference was significant. A reduction in pain of minus 0.76 may not seem as much, but compares very well with what the most potent opioids did for cancer pain in a recent meta-analysis. Interestingly, both combined iOS and Android groups significantly reduced anxiety. Looking at the device combinations separately, both the iOS and Android self-hypnotic relaxation apps, here shown on the right side, reduced pain, that's the red columns, and anxiety, that's the blue columns, significantly and comparatively. The iOS app here on the left side neither reduced pain nor anxiety. Thus, it can serve as an ideal placebo or control app for clinical control trials. Surprisingly, the Android app significantly reduced anxiety, even though it had the same content as the iOS app. We were puzzled why the same content reduced anxiety with the Android white noise app and not the iOS one. One explanation may be that the Android white noise app defaulted to exterior noise, versus the interior one tended to default possibly towards interior noise, which is an unfamiliar noise for most. Familiar outdoor noises may be more soothing than the interior noise, which in this control was a washing machine. Further research should be done on comparing exterior and interior noises. Nevertheless, the self-hypnotic apps were significantly better than the white noise controls because both the iOS and Android self-hypnotic apps significantly and reliably reduced both pain and anxiety. Pure sound apps are tricky. The same content doesn't necessarily produce the same outcomes. Just because one sound is soothing in one system doesn't mean it will be so when delivered in another system. It may also lead to faulty acceptance of efficacy. On the other hand, one cannot assume white noise to be a placebo in a clinical trial unless it has been tested. Reliable pain and anxiety reduction requires targeted and tested suggestions that are immune to system variability. Our experience also stresses that it is critical to have apps tested before introducing them in clinical practice. Overall, we can say that use of a self-hypnotic relaxation app in the waiting room is feasible and effective and reduces pain and anxiety in meaningful ways. We hope this is helpful when you evaluate and choose an app for your practice. Thank you.